Hey, this is Mark Garrett, co-owner at National Senior Savings, bringing you the Medicare Learning Module from the Medicare Minute, our podcast over at iTunes and Google Play Music. This is module number 8. Which is better for me, a Medicare supplement versus a Medicare Advantage plan? Now, this is a question that I get asked all the time by clients because they want to know what's the best plan for me that's going to fit my needs, my budget, and help me out the best in managing my health care. So, when it comes to Medicare Advantage versus a Medicare supplement, both types of plans have pros and cons. Some of it may be due to budgeting, some of it may be due to restrictions on network, and we're going to get into that in just a minute. A big factor is where you live. Another factor is how much you travel. The most deciding factor is, do you want the ability to manage your health care? So the first thing we're going to look at is cost. Medicare Advantage usually have a lower premium, or in some instances, they have no premium at all. Medicare Advantage hits you with copayments on almost every service you receive. That's doctor's visits, hospital stays, ambulance rides, MRI, lab work, surgery, or all services you should expect to pay a copayment for. So even if you're paying $0 a month for your premium, you can guarantee that you're going to pay for all of those services. And as we discussed in earlier modules, a Medicare Advantage plan is allowed to charge up to $7,200 per year out of pocket maximum. Very rarely do people who are 65 and fairly good health ever reach a limit like that. But as you start to age and you start to get more health complications, it's much more likely you will start hitting those maximum out of pockets. Medicare supplements usually have a higher premium depending on the plan. So if you go with a Plan F or a Plan G, they're both going to charge you a monthly premium, just like all Medicare supplements do. And you may decide, hey, that's too much. Like a Plan F, you may pay 140, you may pay 120 for a Plan G per month, and you decide that's more than I'm budgeting for. So you have to keep that in mind when you're shopping and you're initially enrolling. Some Medicare supplements have little to no copayments for services received. So remember, the flip side to that is you may pay more for that Plan F or that Plan G, but you're also going to have no copayments anywhere you go to the doctor or the hospital or use services like surgical services. So you got to keep all those things in mind when you're deciding what's best for you. Location plays a huge part in it. So some large cities have Medicare Advantage plans with no premium and often larger networks to choose from. So there's more doctors, more facilities that are willing to sign a contract with that company to allow you to see them. Not all of them, but there's more because it's a big metro area. And with that being a big metro area, a lot of times you see no cost whatsoever for your premium, just the co-payments. Now, some rural counties and cities do not even have Medicare Advantage plans offered where they live, so their only option is to stick with original Medicare or get a Medicare supplement plan to go along with their original Medicare. Medicare supplements are available everywhere. You got to keep that in mind, from large cities to rural towns. So there's no restriction. A Medicare supplement you can buy in every county in your state. It doesn't matter. They don't have a network that they're working with, so therefore they don't have to have those services available to you close by. They can sell it to you and you can go anywhere you need to go to get your treatment done. The next issue that you got to look at is traveling. So when you retire, are you going to travel a lot? Are you someone that's going to be at home? Are you going to go down like a lot of snowbirds down to Florida for 6 months and then go back up north, and you're going to have two physicians at each different location? So first thing, Medicare Advantage HMOs may only cover emergency room visits, urgent care visits if you're out of network. So other than going to the emergency room or going to an urgent care, you're not going to be able to establish any physicians in a different location. Medicare Advantage PPOs may allow for you to travel more with the much higher out-of-pocket cost if you're not within the plan's network. If you remember in previous modules, we talked about even PPOs have a network. Usually it's that city or that county or that state that you can travel within, and you'll being network, but if you get out of that region, you're going to have to go out of network and you're going to have to pay the higher fee for out of network services. Medicare supplements, hands down, when it comes to travel, there's nothing like a Medicare supplement Medigap plan. They allow you to travel and use your services any place you go that accepts original Medicare. A few of the plans even allow for international travel, which there are quite a few people when they retire, they want to go see the world and they want to know that they're covered if they should go overseas and need that benefit. So, managing your health care. Medicare Advantage plans all come with some type of network. I stress that all the time. There is a network. If you don't like networks, Medicare Advantage plans are not for you. HMOs are the most restrictive because you have to have a designated PCP and he or she must write referrals to other network providers. PPOs allow you to choose your PCP and specialist without any referrals, but you still will pay a higher cost if they are not in the PPO network. Medicare supplements, Medigap plans allow you to choose any provider anywhere in the country that accepts Medicare. There's no higher cost and no referrals. So when it comes to managing your health care, there is no plan like a Medicare supplement for allowing you to make the choices that you want to make. A lot of people might think by listening to me that I'm so, in summary, only you can be the judge of what's affordable and desirable to you. Not everyone can afford the monthly premium of a Medicare supplement. Not everyone wants to be told which provider they must use. Medicare Advantage can appear to be a good choice in the beginning because of little to no premium, and at 65, many people only go to the doctor once a year. But as you age and your health declines, that $7,200 out of pocket maximum can surely put a big hit on your budget, and more than likely, you will not be able to switch to a supplement at that time due to health problems. So, if you're one of these people that says, I want to pay little to no premium, I want a Medicare Advantage plan, and when I get sick, I'll get a Medicare supplement. It doesn't work that way. When you get sick, you'll be medically underwritten, and more than likely, you'll be denied. Hey, this is Mark Garrett with the Medicare Minute Podcast, co-owner at National Senior Savings. If you got any questions at all, it costs no money to call me whatsoever at 800-708-5810. I deal in all of the different types of plans that are on the market. I am a Medicare specialist. I'm here to help you. So thank you very much for joining me, and you have a blessed day.